Halida Aoko, a community health worker, is in charge of 100 households in her community. It is a service she takes pride in, but one which we quickly learn poses many challenges.
She was telling me that she gave birth at the hospital, and these are the challenges that I wanted even people to come and see.
Lynette has given birth to 7 children, and all of them under the care of a traditional birth attendant. Now, this brings to fore the challenges that community health workers in this area actually face in trying to convince expectant women to deliver in health facilities. What this means is neither her nor the baby was attended to by a midwife, a matter that puts not only the mother but also the child at risk of infections, having not received the first BCG immunization 2 weeks later.
She went for only one ANC visit. No, it is now going to give me hard time to follow up to see that the child gets all the required immunizations.
Perhaps having previously delivered 6 times at home, Lynette saw no harm in home delivery, despite the fact that some women have not been so lucky to come out alive, either over bleeding to death or developing complications due to unskilled birth attendants.
Manadhi dala nero, omiyoga ji yadh kienyeji. Tadhi neno miya yadh kienyeji, monda madhi oduokna ich borno chien. Asto emogine. Ema ongisa ni gini en muech koro beda kar kairi.
It is for this reason that community health workers continue to refer expectant women to health facilities for antenatal and postnatal care. Pamela Sombe, a nurse at the Dede Health Center, says community health workers have bridged the gap where otherwise it would have been difficult for the facility to reach the community.
We have tried. Actually, you may get 2 out of 10 coming with the history of having delivered at home, but quite a number have changed. We have seen a great change that mothers now are positively coming to the health facility to get services and get delivered under skilled delivery.
Since its inception in 2006, Community Health Strategy, with the support of the government and development partners, has seen the number of community health units increase to about 8,000. However, to achieve universal healthcare, there is need to scale up these numbers. Maria Ambo reporting for Health Matters. Vast tracts of sugarcane plantation characterize Awendo district. But beneath this seemingly thriving sugarcane plantation is a looming health problem, that of malnutrition. With vast lands dedicated to planting sugarcane, little is left for planting sustainable food crops. It is here at the Awendo District Hospital that we come face to face with the reality of malnutrition. Almost every child admitted here is suffering from one form of malnutrition to another. This month alone, the hospital has admitted 21 children, mostly under the age of 5.
9 had a severe with complications, but 13 were just severe acute malnutrition.
It is for this reason that Halida Aoko, a community health worker, is on a mission with every rising of the sun. During one of the outreaches, this little girl was found to suffer from marasmus, a condition brought about by a lack of balanced diet. The effect of the condition clearly is seen on her dry skin.
This is a child that we got during outreach hours. There is a camp that we brought here at Kodeng Primary School. And when we looked at the body was, we saw her as a person, as a child having marasmus, because the body was swollen.
It has been a monthly routine of follow-ups to ensure the child's health improves.
She was straight away introduced with the supplement that she has been using for the last 3 months. It is now our work to come back and see the way the child is progressing.
Tom Wanyama, the Community Health Strategy Coordinator in Awendo Sub-District, acknowledges the positive impact community health workers continue to play, without which public health officers cannot achieve their targets.
Initially, people used to get diseases in the community used to die, used to have maternal death and the rest. But through these community units that have come up, we are seeing an improvement because they are meant to reverse the trends, the negative trends in the community.
Although to overcome the problem of malnutrition in the area, according to Public Health Nurse Vitalis Ogwethi, concerted efforts from all stakeholders is required.
The link person, it is the eye of the healthcare provider. It's the one that tells the healthcare provider, look, this here we have issues. Why don't you go and see? Because health workers cannot visit all the households.
Heride says remarkable improvement has been recorded since embarking on community health work.
Because of the good work that, of the community work that I like, I've seen it wise. I should not leave this child. And the mother was also sick. I should be coming to see them.
She says community health workers will need the support to ensure members of their households receive the necessary health care. Marie Ambo reporting for Health Matters.
I went to her and I informed her to come here. I advised her to come here. So she has just come now to be seen for the first visit for the newborn to get the BCG and the rest, and herself to be examined.
The number of deliveries have over the years increased in this dispensary since the putting up of this community health unit. But this has not always been the case some years back. Many women in this region prefer to deliver at home under the care of traditional birth attendants, a situation that put many of them at risk of not only death, but also developing pregnancy-related complications. But all that is now changing.
We are conducting up to 10 deliveries per month in this unit. And this is because of the community health workers who are always in the community searching for mothers who are pregnant, direct them to come for antenatal care.
Florence Agutu is such one community health worker in charge of several households within this community, where she identifies expectant women whom she then refers to the Saro dispensary for antenatal care. Agutu's day begins with visits to these homes. On this particular day, one of our clients has delivered. Jacqueline Odhiambo gave birth at home.
She's to have exclusive breastfeeding for 6 weeks. I've been coming here in case of any problem. She's to inform me. Then we talk together over it. Then we take to the hospital if it can be taken to the hospital. Anything which we can do here at home, we do together with her. When I came here, she took the advice and responded very well. Now she has taken her child to the facility, and the child also really got the first vaccines. I'm supposed to visit 87 households within the village.
She documents data collected from the community for recording at the health center. Professor Miriam Were has been at the heart of ensuring community health service takes shape in the country.
If you are in a nation where children are dying and expectant mothers are dying, it's almost like you have no future. So it became a big shock in 2004 that in Kenya, things were getting worse, not better. It was realized that the reason things were getting worse is because we had focused on working only on health facilities, like just health centers, dispensaries, hospitals, but we had forgotten the people, the communities.
The number of women who die during childbirth in Kenya is still high. The World Health Organization states that 360 women die in Kenya for every 100,000 women who give birth.
Here we have mothers who are expecting. This is what we call antenatal ward, but it's the mothers who are almost in what we call second stage of labor. So you see what the community health workers are doing. They ensure that these mothers must attend the clinic at least 4 times. Unaumwa, pole sana. Mimba ya ngapi? Ya kwanza. Ulikuwa unaenda kliniki wapi? Mama Frida. Kihancha. This is also a referral from the community. That's from Korea. This is our nursing home here, our labor ward, caters for even patients from Korea.
Right now, we have 2,511 community units which are providing community health services. And we think that that is a very, very good start. But we are still far because we need over 8,000 community units in order to cover the whole country.
Wanatembea kuangalia wagonjwa wale wako hapo. Wakipata mtu akiwa mgonjwa, wanaripoti kwa hospitali.
I was born in Migori district. I've been here since I was born up to this moment, but I've not been visited with them any day.
As a community health worker, Agutu has had to face challenges.
We used to have very low immunization coverage in this region because of the sect which is around here, where most children are not allowed to come for immunization. But through the community health workers in the community unit, there's a lot of improvement where almost all children come for immunization, which you get children who are fully immunized. We go up to almost 80%.
It is successful because the person who talks to the mothers speaks their language, lives in the same community, knows their tradition, and so they can talk to them appropriately.
Professor Were is however optimistic that with this initiative, lives of many expectant women will be saved.
Community health strategy approach to establish community health services was the most wonderful thing that has happened in our country for a long time.
I think this is the way the whole country should go, that we accept every part of this country to have a community unit to access the community easily, because it's the community unit, because that's level 1 of care, where diseases are discovered or are searched by the community health workers who are trained, and they bring to the community health care workers to manage the diseases.
Our problem right now is that when you go to hospitals, you find that some people are sleeping on a bed, some are sleeping on the floor. Some health centers are very crowded. Why? Because even what is crowding them are the preventable diseases. If we can reduce the preventable diseases from being in the health center and in the hospital, then we shall leave the space for the other diseases which cannot be prevented. No mother should have to have a baby dying in her hands when she's just by herself. She will have a community health worker. That is our target.